Perhaps the most common thing people notice when they see their face is the jowling. And these bother patients because they highlight how old they look. So what causes jowling? I'm Dr. Kenneth Yu, board-certified facial plastic surgeon, and today I want to explain what jowls really are, why they develop, and why understanding the cause is much more important than simply trying to make them disappear. Most people assume jowls are just loose skin. Now that's certainly part of it, but it's only one piece of a much larger process. Think about your face when you were younger. Your cheeks were higher, your jawline was sharper. That transition from your face to your neck was clean and well-defined. That wasn't an accident. Everything was being supported exactly where it belonged. Now, as we get older, gravity certainly plays a role, but it's not the whole story. The deeper tissues of the face gradually begin to relax. Fat pads that once gave your face youthful contour slowly descend. Your skin loses elasticity. Even the underlying bones of your face change over time, providing less structural support than they did decades earlier. And when there's less support and foundation, the tissue and fat above it, which is already losing elasticity and volume, get more noticeable. When all these changes happen together, the tissue that once sat neatly over your jawline begin to drift downward. And that's what creates a jowl. A jowl isn't something that suddenly appears. It's something that slowly develops as the entire face changes. And that's why simply pulling the skin tighter doesn't always create a natural result. One of the biggest misconceptions in facial rejuvenation is believing that everything is a skin problem. And in reality, most of what we're seeing happens beneath the skin. That's why during a consultation, I'm not just looking at the jaw, I'm looking at your cheeks, your jawline, your neck, your facial volume, and your skin quality, and how all these pieces work together. When you pull on your face and see an improvement, it's natural to assume your problem can be solved with pulling the skin tight. However, you have to realize that when you're pulling on your skin, your fingers are also transmitting pulling force to the underlying key structures that are actually more important than the skin. The SMAS, or the superficial musculoskeletal aponeurotic system, is a key structural layer that must be resuspended to achieve the result you're looking for. And depending on the degree of loss, that determines what kind of treatment will work best for you. The sagging may be too early to benefit from any surgery, or maybe it is mild and you're not ready for surgery. Then you can consider options like energy-based devices, careful fillers, or threading. As I mentioned in prior videos, I'm not a fan of these, but I will acknowledge these are very popular options out there. Now, as the degree of sagging or jawling increase, then a mini facelift might be an excellent option. Finally, as the jawline gets more significant, frequently accompanied by loose neck skin, then a formal lower face and neck lift might be the best option for you. Never will one just need skin tightening for any jawline. If you just pull skin, you will definitely be disappointed because the issue is not the skin, it's a combination of loss of skin elasticity, volume loss, and bone resorption. Bottom line, there's no one-size-fits-all answer because people don't age the same way. One of the things I enjoy most about facial plastic surgery is that it's incredibly individualized. No two faces age exactly alike. That's why treatment should not be based on what's trending online or what's worked for someone else. It should be based on exactly what's causing the changes in your face. And this is especially true when it comes to your jaws. They're not simply extra skin that needs to be removed. They're often a sign of deeper structural changes happening throughout the face. When we address those changes thoughtfully, the goal is not to make someone look tighter. It's to restore the natural contours they've gradually lost over time. That's how facial rejuvenation should look. Natural, balanced, and unmistakably like you. If you're interested in learning more about how the face changes as we age, I'd encourage you to subscribe to the channel. Every week I break down the science behind facial aging and explain the treatment options available so you can make informed decisions with confidence.